Crohn's disease can affect any part of the gastrointestinal tract, from the mouth to the anus. However, it most commonly involves the terminal ileum, often in association with the right colon. Crohn's disease is a highly heterogeneous multiple-hit disease associated with periods of inflammation that results in progressive disease due to the complex interplay between host genetics and environmental factors, as well as changes in the gut microbiota and immune dysregulation in the mucosa. However, the direct mechanism and cause of Crohn's disease remains unclear. In the normal gut, with intact barrier function, intestinal homeostasis is maintained by the equilibrium between the luminal content and the mucosal immune system in the lamina propria. However, if barrier defects occur, homeostasis is disturbed, leading to an uncontrolled inflammatory process in which intestinal epithelial cells play a role in modulating the underlying gut immune system. The mucosal inflammation results in the activation of innate immune cells, including dendritic cells and macrophages. The latter produce the pro-inflammatory cytokines such as TNF-alpha, interleukin-12 and interleukin-23. The triggering of this innate response results in activation of the adaptive immune response, with the recruitment and activation of inflammatory T cells, with subsequent release of TNF-alpha from macrophages and dendritic cells. In addition, inflammatory T cells, including natural killer cells, also contribute to the release of pro-inflammatory cytokines. This results in a cyclic perpetuation of cytokine and chemokine-mediated mucosal inflammation, involving both the innate and adaptive immune responses, ultimately leading to tissue damage and destruction. Untreated Crohn's disease often progresses to include chronic inflammation that affects the entire gut wall, giving the gut a characteristic cobblestone appearance, and can result in irreversible tissue damage in the form of fissures in the bowel wall, with ensuing fistulas, abscesses, and intestinal stenosis. At this stage, the associated tissue damage can be irreversible. We can only intervene at earlier stages. Biologic therapies include tumor necrosis factor inhibitors, which bind to TNF and specifically block the action of a key pro-inflammatory cytokine involved in the initiation and progression of Crohn's disease. This leads to a reduction in mucosal inflammation and could help to halt tissue damage and limit the development of stricturing and penetrating features seen in advanced Crohn's disease. Early initiation of biologics in eligible patients before the occurrence of permanent bowel damage could hold back disease progression of moderate to severe Crohn's disease to minimize the need for surgery and keep patients in remission.